talk to you today about the role of the board and the board chair during this pandemic. I chair the board of Eastern Melbourne Primary Health Network, and we're up to our armpits in coronavirus issues. But I'm also on the board of two other organisations affected by the pandemic, RMIT University, affected by the downturn in international students, and the Brotherhood of St Lawrence, which is affected in other ways. When I think about the role of the chair and the board, I like to think about it in terms of the trigger model of governance. And I picked this up in my own professional development as part of the Institute of Company Directors courses. And it focuses on the short-term and long-term role of the board and the external and internal roles of the board. But I'd first like to, if I concentrate on the bottom left-hand corner, the internal short-term accountability and supervision rather. In the middle of the pandemic, we're obviously got to change the nature of our reporting. And there's an issue here that you don't want to overburden management with reporting in the middle of the pandemic. And you've got to have accountability still, of course. And you're obviously able to provide advice and feedback about what the organisation is doing. But there's this, you've got to maintain this balance between monitoring appropriately and voyeurism, where you just like to hear what's happening and all the action and so on, but you've got to restrain yourself because you don't want to overburden management and get them to report every day about what's happening or every week. You've got to actually maintain this balance so you're not getting in the way of management and diverting them from their core business and distracting them. The other thing that is part of this is this shift in the way we work. Also, it's a time when management might need more support. And so you've got to keep on asking, what does management want from the board? And making sure management is able to come back to you and say, look, what we're interested in is this. And to give you another example of that, in the diagonally opposite corner, strategic thinking. When you're in the midst of the pandemic, it's really hard to think about what the future after the pandemic is going to be like. And so what we're saying here is, yes, the organisations need to think about post-pandemic. They need to be doing post-pandemic planning right now. But maybe the board has a bigger role, especially in a small organisation. So in the case of Eastern Melbourne PHN, for example, I've done a lot of thinking in my role at Grattan about the role of primary healthcare after the pandemic and the health system generally. And so it's an area where the board can provide strategic leadership. And so our board discussion in next week or the week after is going to be about post-pandemic planning. What will the system look like? How will the Eastern Melbourne PHN change? And how will our role change to facilitate a different sort of primary healthcare system? Dropping down to the corporate policy, obviously a key thing we do is approve budgets. But in the pandemic world, not quite all the budgets have been thrown out the window, but we've got to spend our money differently. We've established at the PHN small grants to help general practices make sure they've got their infection control right and so on. So we're changing quite dramatically our budget, and we're saying in some areas the budget should not be a constraint. We will run into deficit if we need to in these areas to make sure that the primary healthcare system is well placed to respond to the pandemic. And so that's a critical change in the nature of our relationship. But obviously a critical role of the board is about appointing and rewarding the CEO, and that doesn't change. This is exactly from the trigger model. I would add appointing, rewarding and supporting the CEO. Obviously one of the things I do all the time as a board chair is to check in with the CEO, have formal meetings with the CEO between board meetings and so on. But also I'm now checking in a bit more frequently. Are there things going on? Obviously the organisation is affected, as we all are now working at home. What are the stresses and strains that creates? And so I think we've got to actually think about the way we do things differently. And we've got to actually work so differently and keep in touch with what we ought to be doing as a board and how that ought to change, how the role of the chair changes during this time, how our support functions, our accountability work differently. So I hope that helped. It was useful for me to think it all through. So thanks very much.